Here in the U.S., House Republicans and the Trump administration are still working on a new plan to repeal and replace Obamacare. Correspondent Kevin Corke is at the White House tonight with an update on that. Good evening, Kevin.
Hey there, Brett. Not quite a full resuscitation, but there's little doubt that the president's plan to repeal and replace Obamacare is getting an improved bill of health this evening. This, as a House panel, considers some major changes to the legislation ahead of the two-week Easter recess. Now, those changes proposed by the Trump administration involve a provision for high-risk pools to subsidize insurance for the folks who are seriously ill. Speaker Paul Ryan says the race to replace isn't over, but the pathway forward is a lot clearer now than it was before.
We have come together on a new amendment that we all believe will lower premiums and provide added protections for those facing real challenges gaining access to affordable care. This brings us closer to the final agreement that we all want to achieve.
Now, the amendment before the Rules Committee sets up a federal insurance pool to cover those with conditions like cancer and heart failure, HIV/AIDS. The subsidies, the idea there is to lower premiums for healthier patients, a move Democrats say won't be enough to get them to let down their guard.
But whatever they do, we'll be there to make the fight for the American people. We will not allow them, without paying the price to the American people, to increase out-of-pocket costs, premiums, and other out-of-pocket costs.
All this as the president, Brett, is said to be considering tying, get this, infrastructure legislation to health care reform. The idea is to get those fence-sitting lawmakers on board. And the bottom line from the White House's perspective is to simply put the money back in the hands of the states. Keep in mind that $15 billion that would be part of this new deal, that would help with those high-risk pools. And for context, I think this is important as well. There were more than 30 states that had these sort of high-risk pools before the passage of the Affordable Care Act. Brett?
Kevin Corke live on the North Lawn. Kevin, thank you.